commercial firm would jump at it.
Well, I would think so. But then, and then it has to go through the FDA. Yeah.
Food additive in it. Better than cream and sugar in your coffee.
But what is that spice now? I forgot the name of it, and I just had
Well,
it
I
this.
can't remember the name, and of course it had no meaning to me.
Yeah, but it's short-term
I better
memory.
learn to.
What about shingles? So I decided to look up shingles. In the last 2 weeks, and we get both the Union Tribune and the North County Times, but in the last 2 weeks, this full-page advertisement has been in both of these papers multiple times, put in by the Merck company who makes the shingles vaccine. So we're going to talk a little bit about the shingles vaccine. But first we'll talk about shingles.
Excuse me, what is a shingle? What is a shingle?
Shingles. Okay. Shingles is a skin disease which is manifested by a red rash covered with tiny whitish to yellowish blisters, which we call vesicles. Pink, red rash with blisters on it. It is very painful. Now, it does not occur in any person who has not had chickenpox. If you've had chickenpox, it's possible that the virus resides in the dorsal ganglia of your spinal cord. And it's dormant. And it can be dormant for 70, 80 years. And then all of a sudden pop out in a rash, which is quite painful. Now, when it pops out, it follows a dermatome. And a dermatome is that area on your skin which is supplied by a particular nerve that comes out of your spinal cord and goes around. For example, we take a thoracic spinal dorsal ganglia and it goes around the chest, under the breast, to the midline. Usually half, one half of the body. I've seen it go all the way around, but one half of the body. Very painful. The rash lasts about 3 weeks. The pain may last longer, and there is a condition called post-herpetic neuralgia. And that is a condition of pain after the shingles rash has disappeared. The pain persists. And that may last as long as a year. So the Merck company has developed this vaccine for shingles. And there are a couple of things about this advertisement that I'll mention. And that is, it says, if you're 60 or older, the painful, blistering rash of shingles could be closer than you think. And then across from that, it says, the vaccine is used for adults 50 years of age or older to prevent shingles. And then under important safety information, the first thing it says, the vaccine does not protect everyone. So some people who get the vaccine can get the shingles. That's interesting. Okay. Now, I've given you a sheet of paper, the second sheet of paper, with some numbers on it. The first set of numbers are people aged 70 to 79. There were 7,621 people. They had 156 cases of shingles in these 7,000 people who got the shingles vaccine, which comes out to 0.02%. That would be 200 out of 1,000. No, it would be 200. 0.02%. In the next category, that's greater than 80, that's age. There were 1,263 people, and they had 87 cases of the shingles, which comes out to 0.07%. They also gave a sham vaccine same syringe, same shot, but no vaccine in the syringe, to 7,559 people, and they got 261 cases of shingles. So this would be the general population, and this comes out to 0.034, a higher number, but not a greatly higher number. And those over 80, they had 1,332 people with 47 cases of shingles for 0.035%. Now, what does this say? This says that your chances of getting the shingles are pretty small. And your chances of getting shingles after having your single shot are better, but not zero. Now, not everybody who gets the shingles gets post-herpetic neuralgia. That's the serious problem. Not everybody gets that. In the group of 70 to 79, there were only 12 out of the 156 that got post-herpetic neuralgia. And over 80, in the 80 group, there were 7 out of 87. Now, what you have to do is to decide whether you are willing to take this vaccine, even though it may not protect you, but it does protect, percentage-wise, a reasonable number of older people. Or whether you won't take it. And we're not even going to go into the cost. I'm not sure what the cost is, but I was told by one of our residents who is not here that it cost her over $200 to have this shot.
It's now covered by Medicare.
It's now covered by Medicare.
It is. It is. Now it is.
That I'm not aware of. All right, so when we think about this, we think, well, they're gearing this for older people. And well, one thing I didn't mention. Since the mid-1990s, we've had very good medicine for viruses. All of the medicines we use for HIV work on this herpes virus for shingles and acyclovir. And I don't know how whether or not the people who developed the shingles received the proper antiviral agent that might have shortened the course of the disease and prevented the post-herpetic neuralgia. But there is good treatment for shingles nowadays. Still, there's a risk. The greatest risk to shingles is if you get it in your eye. Then you have a chance of losing that eye. But that's extremely uncommon. So I don't have any recommendation for you as to yes or no. I only give you the numbers to show that there's minimal chance of getting the shingles and even a more minimal chance of getting post-herpetic neuralgia. Then it's up to the individual to decide. One thing further. I have 2 boys, mid-50s or getting to be 60, and they never had chicken pox. And my boys have children, and they never had chicken pox. And I think shingles will not be heard much of in succeeding generations. Now, we had chicken pox. Everybody in my family did. All during the Depression, I'm sure most of you did too. But the risk, I think the risk is small, but there is available something if you want.
Thanks, Doctor.
I deliberately didn't answer the question.
I was told when I asked about the single shot, that if you ever had shingles, they didn't want you to take the shot.
Yeah, I know.
It wouldn't serve you a purpose.
Yeah, I'd have to look it up, but I have never seen anybody have the shingles twice. You've had them twice?
My husband had it 3 times.
Oh, okay, well, let me say one more. See, then we get into stuff. Okay, who gets the shingles? The people who are most likely to get the shingles are people who are immunocompromised. They have some kind of disease affecting their immune system that makes their immune system not function as well as it should. Or they're taking medication that interferes with their immune system. Medications now that you see on the TV and advertised in the magazines for arthritis and fibromyalgia and this and that, all of these affect your immune system. People who have kidney failure, people who have liver failure, people who have leukemias, all are immunocompromised. Anybody that's received a transplant is immunocompromised. Their risk, of course, is higher. And sure, they should be immunized. But the ordinary person who doesn't have all this stuff has a small chance of getting this disease. And if given the proper treatment, has even a lesser chance of getting into complications. Okay.
A number of people who live here were part of the study. I know B. Armstrong, who's in Germany, was part of it.
I was.
They were part of that study.
It went on for about 5 or 6 years, didn't it? Well, I was even on the follow-up study. And there are quite a few people that have, since they've been living here, have had shingles. Corridors that have two or three in our building in the last few years.
Well, they're saying that several of the people were in a study about the shingles and the vaccine.
Well, some of us had the placebo, but if you had the placebo, they told you right down and gave you a shot for the shingles. After the study was over.
After the study was over. Yeah, okay. Well, then you may be part of this thing.
Is it
Margaret? I have never seen a shingles patient's spouse get the disease. And I said it lasts 3 weeks or more, and they're living together closely. I've never seen it happen. I can't answer that. I don't think it is, unless the person, this person has the shingles, this person's immunocompromised, yes, there's a chance. This person has shingles, this person is a normal, healthy person, I don't think so.
Couldn't you get chicken pox from it?
No. The chicken pox is a dying disease, except now, in the paper yesterday, there was an article about the parents refusing to vaccinate their children, and now we're seeing some of these diseases again. Also, I read about, we thought we killed polio worldwide. Polio is now in Pakistan and China. They're not getting the vaccine.
I read some anecdotal information, not a full study, that suggested that people who had the Zostavax vaccine, the severity, even if they did subsequently get shingles, the severity of the incident was reduced. Now, I haven't seen any confirmation of that.
No, that is correct.
And,
that is correct.
Now,
it's reduced, but there still was a percentage that got the post-traumatic neuralgia. It was 12 out of 156 for the 70-79 and 7 out of 87 for the over 80. It is a greater risk for those over 80, apparently. I can't say why, but statistically they show that.
Now, would the chickenpox vaccine itself give you the virus, latent virus?
No. This vaccine contains live chickenpox virus. The one they give to the children does not. Okay, all right. To answer your question, Gordon.
It certainly did. Thanks very much.
What did you say?